Hi, I'm Dr. Siddhartha Vittal. Welcome to Sportsmed Doctor. Happy New Year to everyone. I hope every one of you are safe, especially in this Omicron times. So please do mask whenever you are going out, and if you've got any symptoms, please do get tested and quarantine yourself if you have been turned positive. So today I'll be making a small video on since on the counseling aspect, since the counseling is started already, and so I thought that I'll just explain upon where all the seats are available, and then a few questions which has been asked to me, for the past 1 year since I put the video out. What and all questions have been asked. Some of them repeated questions, so that is what I'm going to try to answer on this video. So let's start with the available seats. As you know, there are the MCI accepted qualification. There are only two qualifications, that is the MD Sports Medicine and the PG Diploma Sports Medicine. No other qualifications in sports medicine is accepted. So you might have heard of already of the International Olympic Committee course, which is an online course. You would have heard about fellowships. You would have heard about MSc Sports and Exercise Medicine courses, which is available outside India. All these courses are not accepted by the MCI. It is not It's not considered as a sports medicine qualification based according to an Indian degree. Please do understand. So if people who are contemplating on whether to take up MD Sports Medicine or some other outside international course, please do consider take up MD Sports Medicine, because that is the only accepted course in India. Now we'll go into the seats availability. So in MD Sports Medicine, there are a total of 18 seats in India. So let's take up the government colleges first. So you have the AFMC, the Armed Force Medical College. They have 2 seats available. Then you have the Safdarjung Medical College, which is in Delhi. They have around 5 seats. Then you have the PGIMS Rohtak, Haryana. They have 1 seat. And then you have the RIMS Manipur. They have also 1 seat. So these are all the government colleges available. Now coming to the private medical college. So in the private medical college, you have the SRMC Medical College, which is in Sri Ramachandra Medical College, which is in Chennai. They have 5 seats. They have increased their seat from 3 to 5. Then you have Chettinad Medical College, which has got 2 seats. And newly started course, MD Sports Medicine for this year has started in Savitha Medical College, which is also in Chennai, for 2 seats availability. So total of 18 seats are available in MD Sports Medicine. Now coming to PG Diploma Sports Medicine, there is 6 seats available. It is available in NIS Patiala. That also the counseling will be happening through NEET. So these are the total seats which are totally available. So you've got 18 seats and you've got the 6 seats. Now let's come to the questions, which are the multiple questions which have been always asked to me. First is cutoff. Cutoff changes every year. Please do understand, I cannot predict the cutoff. It is impossible for me to predict the cutoff because it changes based on demand. So as you know, MD Sports Medicine is growing big time. Like what it was 5 years, it's not now. So MD Sports Medicine is growing big time, and many people are considering to take up that as their career. So the rank which is required to take up MD Sports Medicine is coming down quite dramatically. So last year, to my knowledge, this is to my knowledge, I might be wrong also, for forward it was around 4,000, 1,000 to 4,000, that is what it has gone. For OBC it was around 30,000, that is what is to my knowledge, up to 30,000. You have to understand, I'm saying the last rank. And for PG Diploma it was up to 40,000, that is to my understanding. So please do understand, it could be varying here and there. So these are the seats which I have asked few people, and they have given me the numbers. This cutoff can change every year. Please do understand that. Next, let's go to one of the other questions which was asked to me was, it's a specialist degree. So one of the questions which was asked to me was whether this qualification, if somebody has an injury, they can go for an expertise, they can go to an orthopedician, and if they want something basic, they can go to a physiotherapist. So why go to a sports medicine? And this was asked in different formats to me. So it's kind of, so I thought that I'll try to answer it in as simple as possible. So for example, just take an example that you have got a pneumonia. Now if you've got a pneumonia, you can go to an expertise to a general medicine doctor, or if you are somebody basic, you can even go to an MBBS doctor. But why do you go to a pulmonologist? Because that person is a specialist. So it's something similar to that. A sports medicine doctor is a specialist. So his expertise is, you can't compare to an orthopedician. Similarly, a pulmonologist you cannot compare to a general medicine. Yes, general medicine do read about pulmonology, but it is not the same. So it's it's also for orthopedics and sports medicine. Yes, orthopedics reads a bit of sports medicine, but it's not the same. So please do understand that is the difference majorly. So it's quite different comparatively. So that's why sports medicine is a different field itself, and that's why they started MD sports medicine. Otherwise they won't have needed. There was no need to start. No. Now let's take one another question which was asked to me was about is sports medicine only about teams, working with teams and athletes? No, sports medicine is not about only teams and athletes. Sports medicine is called sports and exercise medicine. That is the full form. So you can actually work, you actually work with a chunk of normal regular people also. 40% of my patients are regular people, and one of the oldest patient which I've had is around 93, 94 years old. So it's not necessary that you work with only old people, with only healthy athletes always. You can work with exercise physiology. One day I work with, my OP is with a rheumatologist. So I see all rheumatological conditions, which musculoskeletal conditions of rheumatology, soft tissue conditions. So that is what, I do practice exercise medicine over there. So it is not necessary that you practice only sports medicine. You can practice also exercise medicine. So that is how you grow also, and you get all types of patients, and you can build up your practice in such a way. These are the few questions which were asked to me. One more question which was asked to me was that should I work with when I work with teams, I'll be always traveling. So will I be always traveling? Yes, if you are with teams, you will have to travel with the team. That is how teams. But you will have off season where you can spend time with your family, or you can do some other work in that gap. But almost 6 months to 4 months to 6 months you will be traveling with the team. So take football ISL, it will be around 4 months. So you'll be working 4 months with the team, and then pre-season you take another 1 month. So 5 months you'll be working with the team. While the rest 7 months you will be free totally. So you can work with other teams, or you can have your own practice accordingly. So that's how you practice, and this is what is all about. Working with the team and having a practice in such a way. So I hope I've answered most of your questions. If you've got any doubt, please do comment below. I'll try to answer. Once again, best of luck to all the people who are trying to join MD Sports Medicine and PG Diploma in Sports Medicine. My best wishes, and hope all of you get your wishes done. And if you have joined MD Sports Medicine, definitely you will get to talk to me and chat with me, definitely. So hope to meet you soon. So once again, best of luck, best wishes, and see you for the next video. Thank you.